Hi, I'm Doug Reinemann, Professor of Biological Systems Engineering and Director of the Milking Research and Instruction Lab at the University of Wisconsin-Madison.
Hi there, John Penry is my name. I'm a research assistant here at UW-Madison in the Milking Research and Instruction Laboratory.
Today's session will be a continuation of our series on evaluating milking performance. Our topic today will be evaluating the performance of the liner.
Doug, before we get into the specifics of liners, if you were describing to someone an overview of liner performance, what sort of things would you describe?
Well, the two main aspects, and I think the most important one, is gentleness in milking. The liner can influence the stresses on the teat tissue, so the gentleness of milking is an important aspect of liner performance. And then secondarily, milking speed. So the liner does have some influence on milking speed. Of course, milking speed is also influenced by vacuum level and pulsation settings. So the two main aspects we're looking at to assess a liner is firstly, gentleness of milking, and secondly, speed of milking.
Doug, how would you describe the most important aspects of liner performance?
Well, I think quite clearly the most important aspect of getting a liner to work properly is getting the liner to fit on the teat or the teat to fit in the liner. So liners have a certain range over which they collapse and apply massage. And the first aspect of liner fit is making sure that the end of the teat is actually in the part of the liner that can apply massage. Secondly, the teat needs to fit reasonably well in the barrel of the liner, so the dimension of the teat diameter versus the liner diameter needs to be fairly closely matched so that the teat barrel will actually fit into the liner barrel.
Doug, there are lots of different physical dimensions to a liner, but what are the most important ones when it comes to describing liner fit?
So let's start talking about diameters, and the point of reference is always the average teat diameter. So to understand how to fit a liner to a herd of cows, we need to know something about what is the typical diameter of the teat barrels. And there's a couple of diameters of the liner that we need to match to the teat diameter, one being the diameter of the mouthpiece opening, and secondly, the diameter of the liner barrel or the mid-bore diameter of the liner. The second series of dimensions that we're concerned with have to do with the length of the teat and the depth of the liner. So the measurement of the teat would be the average teat length from the base of the teat to the end of the teat, and that would be compared in the liner to the mouthpiece depth, which is a measure of the distance from the top of the liner to the highest point at which the liner collapses. So this mouthpiece depth tells us something about the shortest teat that can be milked with that liner. Likewise, there's a collapse length, which would define the longest teat that could be milked with any particular liner.
Doug, one of the things that sometimes gets talked about is, does the teat fit the liner, or does the liner fit the teat? Can you explain this further for us?
Yes, well, the teat is much more compliant than a typical liner. So a liner, once the dimensions are fixed, the dimensions of the liner really don't change that much. But the dimensions of the teat can change. So a teat can be stretched in a radial direction. It can become fatter. If the bore of the liner is bigger than the diameter of the teat will stretch in that dimension and become larger diameter. Teats also always stretch longitudinally, or they get longer when they're put into the liner because of the force of vacuum drawing the teat into the liner. So the teat does have some ability to adapt to the dimensions of the liner. It's important to know, though, that the teat really can't do both of those things at the same time. If it does stretch longitudinally, if it gets longer, it will also get thinner. If it's stretched in a radial dimension, it will tend to become a bit shorter.
Doug, you've mentioned fit a few times now. Can you go a little bit further into this? Why is fit so important?
Well, one of the fundamental roles of the liner is to apply compression to the end of the teat to manage congestion of teat end tissues during milking. So a critical aspect of liner fit is that the end of the teat, the bottom 20 millimeters or so, needs to be in the part of the liner that is collapsing. So if that fit isn't correct, if the end of the teat is not in the zone of collapse of the liner cannot perform its function to relieve congestion. The other aspect of fit has to do with how well the barrel of the teat seals in the barrel of the liner. If that seal is good, if the fit is good between the teat barrel and the liner barrel, mouthpiece chamber vacuum stays low during the peak flow period of milking. If the fit is not good, then the teat barrel will not seal in the liner barrel. Mouthpiece chamber vacuum goes high, and this is a cause of teat tissue congestion.
Doug, just then you mentioned liner compression. Can you just expand on that concept for us a little bit more?
So liner compression is the term that we use to describe how much pressure or force the liner is applying to the teat end when the liner collapses. The higher the liner compression, the more fluids are removed from the teat end tissue, but also the higher risk of hyperkeratosis. Liner compression is difficult to measure directly, so we use a measurement called overpressure, which is a biologically relevant indicator of liner compression, which allows us to compare liner compression from one liner to another.
Doug, in your discussion about what's happening in the mouthpiece during milking, one of the things that might be asked is there much difference between commercial liners when it comes to the size of the mouthpiece depth?
Yes, as a matter of fact, there is. The shallowest liners have mouthpiece depths of round about 3 centimeters, about so much, and the deepest liners have mouthpiece depth in the range of 5 centimeters or more. So that's really quite a difference when you look at the range of teat lengths in typical herds.
Doug, during the pulsation cycle, we know that the liner collapses during each of those cycles. Can you describe for us what's actually happening at the teat during the collapse phase?
So when the liner collapses, it applies compression only to the very end of the teat. And by compressing the end of the teat, the blood and accumulated fluids are moved out of the teat end tissues and up higher into the tissues in the barrel of the teat. And for the congestion to be relieved effectively, those fluids are picked up by the normal circulatory mechanism of the cow. The other thing that happens is the skin at the end of the teat is compressed and stretched, and the skin responds to this by increasing keratin production, and so liner compression is also the fundamental cause of teat end hyperkeratosis.
So we mentioned before that there were differences between commercial liners and mouthpiece depth. Does the same apply for a measurement such as liner compression? Is there a range?
Yes, there's actually quite a lot of difference across liners in the liner compression or overpressure measurements that we've done in our lab. The range from the lowest to the highest overpressure liners is a factor of almost 10 to 1. And this is a much bigger range than the physical dimensions across liners.
Doug, given that there are a range that you've just described in liner compression between liners, if you had a medium or a high liner compression liner, what are some of the pros and cons around liner performance?
Well, just like many other aspects of milking machine settings, there's a compromise between milking quickly and milking gently. So generally speaking, liners that apply high liner compression will milk somewhat faster, but they also apply more stress to teat end tissues and will result in more hyperkeratosis. A lower compression liner will milk a bit slower but produce less hyperkeratosis. In the extreme case, if liner compression is much too low, then it will not manage the congestion of teat end tissues during milking.
So right at the very start of this session, we were talking a little bit about the gentleness of milking. When you're in the field, what are some of the observations you could make which give you a hint to how the gentleness of the liner-teat interaction is going?
Careful visual observation of the teats immediately after the milking unit is removed is an excellent way to assess the gentleness of milking and also liner fit. So what we're looking for are visual signs of congestion, and the most apparent one would be a blue color. Blue color is an indication that circulation has been impaired, congestion has been compromised, and the blue color might occur in the barrel of the teat or the end of the teat or both. Secondly, we're looking for obvious signs of swelling of tissues. We can do this visually, looking for visual signs of ringing at the base of the teat. We can also palpate the teat to see if there are palpable rings at the base of the teat or hardness at the end of the teat.
Doug, you just mentioned the ringing at the base of the teats. What are some aspects of the liner-teat interaction that might lead a cow to having chronic ringing at the base of the teat?
So congestion in the teat barrel occurs because the mouthpiece chamber vacuum is high. So when the mouthpiece chamber vacuum is high, the tissues are stretched radially, and the teat tissues respond to that by toughening up and forming a thickened ring. The other short-term result of high mouthpiece chamber vacuum is lack of circulation, which causes a blue color in the teat tissues because the blood in the underlying tissues has been depleted of oxygen. So both ringing at the base of the teat and blue color are an indication that the liner fit is not right. Primarily, the barrel of the teat is not fitting into the barrel of the liner.
So here we have two pretty common liners that are around commercially, and I'm just referring to the shape. So this is a triangular liner, and this is a round liner. So Doug, can you just give us an overview of some of the differences, if any, that you might see between a triangular liner and a round liner?
Yeah, so generally speaking, triangular liners as a class of liners tend to apply less compression than round liners. And this is primarily due to the way that they collapse. So a triangular liner, of course, collapses in from three sides, whereas a round liner collapses from two sides. So because of the physics of the collapse, and also because the triangular liner spreads the forces over a larger area, 3 planes instead of 2, the compression of triangular liners tends to be less than the compression for round liners. The other aspect of the shape is that because teats are fundamentally round, the teat barrels tend to seal better in round liners than they do in triangular liners. So again, as a general class, triangular liners will have somewhat higher mouthpiece chamber vacuum than round liners.
Doug, we also know that in the commercial marketplace for liners, there are both non-vented and vented liners. And I have here 2 examples of vented liners. Can you just explain to us what sort of role these vents are doing and how it might make a difference?
Yeah, so there's really 3 places that the cluster can be vented. And if the liner is vented, the vent can be located in the mouthpiece or in the short milk tube. The third option is that the vent would be in the claw, and air admission would take place not in the liner, but through the claw. So the purpose of the venting is to remove milk more quickly from the teat end, and also to reduce the vacuum drop between the milk line and the teat end. Venting in the short milk tube or in the claw will have no influence on mouthpiece chamber vacuum. However, venting, if the vent is placed in the mouthpiece chamber vacuum will be reduced, and teat barrel congestion, generally speaking, will also be reduced. So venting of a triangular liner is a strategy to control mouthpiece chamber vacuum, because we know that the teat barrel does not seal as well in the barrel of a triangular liner. And if there's no vent in the mouthpiece chamber vacuum would be relatively higher than a round liner. But if we put a vent in the mouthpiece, that reduces the mouthpiece chamber vacuum, and now a triangular liner can have a comparable or even lower mouthpiece chamber vacuum than a round liner.
So also earlier in this discussion, Doug, you mentioned as an overview, milking speed as a measure of liner performance. Can you walk us through some of the aspects of the interaction between the liner type and the way the milking system is set up that might either increase or decrease milking speed?
So milking speed, as described either by average milk flow rates or peak milk flow rates, are influenced by three different things, and these are all interactive. The most important parameter affecting milking speed is teat end vacuum, or the milking vacuum level. Secondarily would be the pulsation settings, the pulsator ratio, or more specifically the milk to rest ratio for a specific liner. And then thirdly would be liner compression. So you really need to consider all three of those aspects together when you're trying to assess milking speed. And of course, we're always balancing milking speed against gentleness. So anything that will increase milking speed also tends to be less gentle when milking the cow.
Doug, earlier on you mentioned how increasing liner compression might alter the risk for hyperkeratosis at the teat end. Can you just expand on this topic a little bit for us?
So hyperkeratosis is caused by compression and stretching of the skin on the exterior of the teat. And the thing that causes this compression and stretching of the teat is the collapse of the liner. So the more compression we apply with the liner, the more the skin is compressed and stretched, and the higher the risk for hyperkeratosis. So the primary influence on hyperkeratosis is the compression of the liner. Secondary influences have to do with how long the teat is being compressed. So things like overmilking and stage of lactation also influence hyperkeratosis, but those are secondary factors behind the compression that the liner applies to the teat end.
Doug, when looking at the interaction between the liner and the teat, once you go from the high flow period in any individual teat to either low flow or no flow at all, so the milk has stopped flowing, is there any change in the way the liner and the teat interact?
Yeah, a big change occurs when the sinus of the teat is emptied. So once the milk stops flowing from the cistern into the sinus, the milking machine very quickly empties the sinus of the teat. And then what happens is the teat collapses. It becomes much narrower and typically longer. And when this happens, the barrel of the teat no longer seals in the barrel of the liner. Mouthpiece chamber vacuum is typically increased. And this is the point in milking where teat congestion is greatly accelerated because we've got higher mouthpiece chamber vacuum typically, and because there's no positive pressure in the sinus, the longer overmilking persists, you can actually start to develop a vacuum inside the teat sinus.
So we hope that you've enjoyed this brief snippet looking at liners and liner performance. Of course, this is a much deeper subject with a lot more detail attached to it, but we hope that you've enjoyed this beginning journey into liners and liner performance.